This is breast augmentation post-consultation video part 2. There is no increase or decrease in breast cancer due to breast implants, but there are possible problems with obtaining a satisfactory mammogram. The X-ray beam cannot penetrate a gel or a saline-filled implant. It is therefore necessary to do an extra view called an Eklund view. To do this, the radiology tech will push your implant up and sweep your breast off of the implant. It is by this manipulated view that an adequate study can be performed. The firmer the breast becomes, the more difficult it will be to get a satisfactory mammogram. In this situation, either an MRI scan or an ultrasound will be necessary. Several large studies have been completed that show women who have breast implants do not develop breast cancer at a greater rate than women without implants, and women with breast implants are not at an increased risk for the late detection of breast cancer. If you're interested in a pregnancy following your breast augmentation, then it's important to understand a few facts. Breast augmentation will have no effect on pregnancy, and there have been no reported birth defects. There's a possibility of decreased ability to breastfeed following breast augmentation. Breast sagging is possible following a pregnancy. If you have small breasts to begin with, then most likely your breast will return to your normal pre-pregnancy shape. You must understand that some women, especially those that gain a good deal of weight or the breasts get very large, may not return to their pre-pregnancy shape. If this occurs, then a breast lift may be necessary. A breast augmentation is typically performed as an outpatient, either at the outpatient area of the hospital or in our certified in-office surgical center. All anesthesia is administered by a board-certified anesthesiologist from Gwinnett Medical Center. Our office surgery center is accredited by the American Association for the Accreditation of Ambulatory Surgical Facilities. You should consider the 3 locations for your incision and which incision is best for you. Most women take pain medication night and day for the first 2 to 3 days and then night only for a few days after this. It is unusual for anyone to be in excruciating pain not relieved by oral narcotics. There is always a chance of loss of sensation to the nipple, areola, and breast during a breast augmentation procedure. Every effort is made to keep away from the nerves that supply these areas. The nerves arise between the ribs and travel over the muscles through the breast tissue to supply the nipple and the areola. To protect the nerves, only blunt dissection is performed in these areas. Other risks associated with breast augmentation include, but are not limited to, bleeding, infection, numbness, asymmetry, implant failure, stretch marks, wrinkling, and implant malposition. If the implant is removed after 10 years, the breast may not look exactly the same. This is due to the possible overstretching of the skin. However, less than 1% of women ever ask to have implants removed. After surgery, you will be instructed how to change your dressings and how to wear the post-operative bra. You'll also be instructed how to massage your implants. We generally instruct our patients to begin breast implant massage during week number 2. If the implant is under the muscle, the technique involves pushing the implant up and in. Gravity takes care of down, and the muscle tends to push the implant out. Both implant manufacturers have a lifetime warranty on the implants. If the implant leaks in the first 10 years, they'll supply you with a new implant and pay replacement costs up to $1,200. After 10 years, they'll always supply a new implant. Remember, the rupture or leakage rate is reported at 3 to 4% for the first 10 years. This patient had 325 cc implants placed under the muscle using the crease under the breast. This patient had 375 cc implants placed under the muscle using the crease incision under the breast. This is the patient who wanted a breast augmentation using the transaxillary approach. A surgical telescope with a camera is used to perform the procedure. This is what it looks like on the monitor. You can see that there is no blood in the surgical pocket. As part of the no-touch technique, 2 retractor instruments are used to guide the implant into place without touching the skin. The retractors have been dipped in the antibiotic solution. The implant has been prepared using the no-touch technique and will be inserted into the pocket. I have personally been using the no-touch technique since 1992, and since this time, I have reoperated on 2 patients on one side each for a capsular contracture. Needless to say, I'm very happy with this additional technique. The implant is then filled with saline solution through a closed-loop system. All of the air has been removed from the implant as it was carefully prepared for insertion. This is the patient at 3 months following breast augmentation. After surgery, you should expect the bruising and swelling to subside over the first 1 to 2 weeks. The sutures will be removed within 7 to 10 days. You can expect some swelling and stiffness for 1 to 2 weeks. You'll be given prescriptions for medications following surgery. You should have these prescriptions filled prior to surgery. These medications will be for postoperative pain, antibiotics, muscle spasms if they occur, and postoperative nausea if this is a problem. Your early appearance following surgery may seem unnatural. The implant has been placed under the muscle of the chest wall. The muscle tends to flatten out the implant. This may cause the implant to appear high, and there may not be the expected breast projection. This will improve over the first few weeks as the muscle accommodates to the implant. It is not unusual for one side to soften up faster than the other. It may take several weeks or even months in some cases for the breast to assume their final natural position. The recovery process will of course be different for each patient. In general, most patients can shower after 24 hours. If there are paper strips over the incisions, then these will be removed on your first postoperative visit. Most patients will be instructed to wear a bra for the first several weeks following the operation. The most critical feature is the formation of the capsule around the implant. This takes place during these first few weeks. For the first 4 to 6 weeks, you should avoid any activities that cause the breast to bounce up and down. It is this jackhammer effect that causes an abnormal stretching of the implant capsule and lead to implant malposition. Light activity is okay. This may include walking and the use of an elliptical machine, but running, jogging, and high-impact aerobics are to be avoided for the first 4 to 6 weeks. Following the initial period, you may gradually get back to your normal activities. A breast augmentation is an operation with a high degree of patient satisfaction and typically results in an improved breast size and shape that will be enjoyed for years to come. Thank you for your interest in our practice, and if there are any further questions, please let us know. More information can be found at primacenter.com. Thank you.